For the majority of you, if you are being monitored and are having surveillance, an operation will be something that's planned, and you will have time to prepare yourself, and it's a great opportunity to get yourself in as best condition as you can, because it helps with the recovery and it helps limit hospital stay and things like that. So these are just a few of the things that are worth looking at prior to the hospital, and probably any pre-assessment nurse that you see in the run-up to surgery will be talking to you about this as well. So reducing alcohol intake, the guidelines now are 14 units a week for men and women, and we would definitely recommend staying below that and trying to have a few alcohol-free days each week as well. I think the biggest thing is, if you're a smoker, stop smoking. Smoking is bad for the aorta, it's bad for the lungs, and can prolong the need for ventilation, increase your risk of infections and things like that. So if you need help to give up smoking, definitely speak to the GP or pharmacist about smoking cessation advice and help that you can get. A lot of clinics now, pre-assessment clinics, will give you some deep breathing exercises to do as well, because that's really important after any heart operation. So ask about that, because it can get you used to the types of exercises you need to do in that post-op phase and really maximise your lung capacity as well. We talk about dental checkups, which I'll mention a little bit later on as well. Just if you're having a valve operation in particular, it's really important to get your teeth checked to limit the risk of endocarditis, and I'll explain that in a little bit. Try and take some regular exercise. Obviously, we had that brilliant talk from Dr. Gatti, and we need to, if you are waiting for surgery, the likelihood is that you will have an aorta that needs intervention, and you may have a valve that's not functioning so well. So that exercise needs to be done with caution. And I'm talking about gentle exercise like a walk, just staying slightly active so that you're not losing all that conditioning that you have, muscle mass and things like that. So I think it's worth talking to your doctor about what is safe for you to do, and just continuing with the bare minimum that you can manage in the run up, and not doing nothing, because that will not benefit you in the long run. Try and eat well, and have a think. The psychological support and planning for discharge, I kind of put hand in hand, because it's good to think about what you're going to need after an operation, what kind of support you might need. Basic things like who's going to be at home with you, who's going to do your shopping, do you have to worry about kids' school drop-offs and things like that, because planning some of that stuff in advance means that recovery is a lot less stressful. So just some of the other practicalities that you need to think about. How are you getting to the hospital? Usually it's not a local hospital. You may be going to a specialist centre, so speak to them about accommodation for relatives and things. They'll often have hotels or accommodation for relatives to stay in. Something obviously that people may not think about is just asking for a longer bed. If you are, we were just talking about height and height restriction in our coffee room, and if you are very tall, the hospital beds in the hospital may not be long enough for you, and it's really not conducive to recovery if you're in a bed that's too short and either your head or your legs are hanging off the end. So speak to them. They are able to order bigger beds, longer beds, so it's definitely worth speaking to them so that you can be comfortable when you're recovering. And I think, unfortunately, as the NHS is as it is today, it's important to try and prepare yourself for the possibility that there may be a cancellation, even up until the last minute. There are sometimes emergencies that have to go to theatre straight away, or there may be problems with patients that have had surgery the day before, and there are no beds to look after you safely after an operation. So it is unfortunately a reality at the moment, but they try to keep that to a bare minimum, avoid it if at all possible. So from the pre-op straight to the post-op, lots of people will be having various different operations, and Professor Nina did a good talk this morning about different types of operations that people might be going through. But the post-op recovery is usually quite similar for everyone, and everyone will start in the intensive care unit, which can be quite an unfamiliar and daunting environment for some people. Now, often it's the relatives that find this most difficult, because you will probably find that the patient themselves that has had that surgery isn't going to remember the intensive care part. They're going to be either asleep or very drowsy with medication. So I think it's important, just if you're a relative and you're going to be visiting your loved one, just prepare yourself that it is going to be quite an odd alien environment, lots of beeping, noise, and your relative is going to be attached to lots of drips and drains. And this is just an idea of some of the things that will be attached. And all of these are used either to monitor, to provide oxygen. So when you first come out of the operation, you're going to be unable to breathe for yourself because you'll be anaesthetized still. So you will have a breathing tube in place, and that will be removed as soon as possible. As soon as you're more awake and able to breathe for yourself, that will be removed. But the others will stay in for a little bit longer, and they are basically for monitoring, to let any fluid drain out that might need to from the chest drains, to give you medications, and to keep a constant eye on your blood pressure, your urine output, make sure your kidneys are functioning. And really, it's just that intensive period of monitoring to make sure everything is stabilized after the operation. So that's the idea of the intensive care unit. Relatives can visit. Usually it's limited to 1 or 2 for a short period of time, and so it's good to make a bit of a triage system and pass information on to other loved ones, rather than have 16 members of the family ringing up one after the other to find out how everything's going, because that can obviously take staff away from the patient who needs them by the bedside. So one or 2 people to visit and pass on all of that information. But hopefully this won't be a long period of time, possibly 12 to 24 hours. These are all approximate, obviously. Everyone recovers in a different way. I wanted to mention delirium today because we've been to a couple of conferences recently, and some of the feedback we had from people who had had cardiac operations was that they didn't really know that this was something that could happen. And I think it's really important to make people aware that it is possible that after a heart operation, your relative or you yourself can have an episode or a period of time where you can be quite confused, not quite sure what's going on, and that is multifactorial. But I think it's worth knowing about, so you can just have that in the back of your mind, that it might be something that happens. It's usually very transient. You may not even remember suffering it, but it can be something that relatives remember, and so it's worth being aware of, so that you can actually manage expectations. So it's just that post-operatively, when you wake up, you can have slightly fluctuating mental status. You might not be quite orientated to where you are, what's been happening. You might have some disorganized thinking. Now, sometimes it's hyperactive. So obviously that means things like people can be a bit agitated, pulling at lines, get rid of, you wake up, you don't know where you are. Or it can be quite hypoactive, and that would mean that people are quite quiet, quite withdrawn, not answering questions appropriately. And that one is often more difficult to spot. And it's really important that the medical team or the nurses know if you think your family member isn't quite cognitively as they usually are, because it's important for them to know that and monitor that as they move on, and make sure that is all resolving. So do mention it to staff if you are noticing that your relative isn't quite as they usually would be. It is quite common. I mean, the numbers range vastly. So 16 to 73% of people post cardiac surgery in one study that I was looking at were reported to have some form of confusion or delirium post-op. And in another older paper, the incidence was between 5 and 30% post-aortic surgery. And so it's just something to bear in mind. Some of the risk factors, obviously advanced age, other conditions that you already have. Somebody might already have a degree of dementia or a diagnosis of Alzheimer's, or they might have a psychiatric diagnosis, which could put them at more risk of developing those that delirium or confusion post-operatively. Excessive use of alcohol is also another risk factor. So these are some of the things that you can mention to your medical team beforehand, and they can hopefully mitigate some of those risks. But there are obviously other things that they can't do much about. The time that you need to be on a bypass machine, the anaesthetic that you have to have, the sleep deprivation in the ITU can be significant. You obviously need lots of different medications, and there is always a risk of infection which can contribute to that. So I would just say that the things that can help with that, if you do drink to excess, try and reduce that slightly before your operation, because that will hopefully help. And then all these other things are things that the staff within the hospital can help with. Making sure someone's not in pain, making sure that they're well oxygenated, that they're hydrated, try and make sure they're getting good sleep. And if as a relative you are there, make sure that if they wake up, you're there, you're reassuring, you're letting them know where they are, what's been done, and repeating those things over time, things should start to settle down. And one of the real basics is make sure that they have their glasses or their hearing aids next to them when they wake up, because nothing is going to make you feel more disorientated than not being able to see or hear in an unfamiliar environment. So really basic things like that can really help mitigate those problems. So this is just the usual post-op course that we would expect. As I said, it's not how everyone's recovery goes. You will have ups and downs along the way, but it's useful to just have a bit of an idea of what to expect. And it's a major operation, so it's a recovery that takes time, and unfortunately you have to be patient. And what can be difficult about the surgery that people have for Marfan syndrome is that you may go into the hospital feeling completely well. You're not having an operation because you're sick, you're having an operation to prevent a problem in the future. So you could come into the hospital feeling 100% and you come out feeling dreadful, and that can be quite difficult to deal with. So it's preparing yourself for the fact that it's going to take you a while to get back to where you were before, and hopefully better. So just that first 1 to 7 days usually are spent in hospital. Days 1 and 2 in the intensive care. I've just mentioned a few of the things there that you would be expecting to do. And as you can see in all of these, I'm mentioning pain control because it's so important for patients. If you're not in pain, you are much more likely to do all the things you need to do to aid a rapid recovery. So if you have lots of pain, you won't be taking deep breaths, you won't be moving around in bed, you won't be able to sit up in your chair and cough and do all of those things that you need to do. So make sure that you are getting your pain well managed. And obviously with Marfan syndrome, there may be other causes of pain, joint hypermobility, chronic pain in those joints. So they're going to have to address all of that in order to help you recover well. And I think don't be frightened to mention that to the nurses and doctors, because there are lots of different painkillers that can be offered to help with that. But I think it's one of the key things to manage. So by the time you're discharged, you should have done some stairs with the physio. So the physios take you up and down a flight of stairs just to make sure you're able to do it in a supervised environment, so you've got some confidence to do it when you're going home. You should definitely be going home with a discharge summary so that you know what's been done, what medicines you're on, when you should expect to follow up. And I've mentioned here again endocarditis. So if you have had a valve replacement, you should be given an endocarditis risk card by your hospital and advised of the risks. So endocarditis is quite a serious condition, which is an infection that can happen within the lining of the heart, and particularly the valves if they're abnormal or if they're replacement valves. And so if you have a valve replacement, you automatically become slightly higher risk for endocarditis. So you need to be aware of that, and you need to be aware of things like certain procedures, including dental procedures, you are going to need antibiotic cover in the future. And that's something that the hospital will tell you about, and that they will give you information for your dentist and people like that. So it's really important that you're told about that. And if there are any wounds that still need dressing or stitches that need removing, the hospital will organise that for you. I would say once you get home, you need to kind of break your recovery down a little bit. I think in the first few weeks, you need to manage expectations. People describe really labile moods, so feeling quite elated one day, very low the next, and that's quite normal in those early days. And I think you just have to go with it. Try and take regular rest, take regular walks, try and eat nutritious food. It's really important that you go to your GP, because some of your medicines may have changed and you need those updated, and accept help if you can. And what we would say is hopefully by that sort of 3 to 6 months, you're back to where you were before. you're able to take regular exercise with advice from the medical team once you've had some surveillance and assessments. And you should be hopefully looking at a staggered return to work or college if you're within that sort of age group and you are wanting to return to those places. So hopefully work will be able to help you with that. And I just mentioned mental health because I think by this point you would hope that hopefully those effects of the early period, the low mood, perhaps anxiety, insomnia, that should have resolved by now. And if it hasn't, I think it's worth speaking to your doctor about perhaps self-referring to some talking therapies or discussing further options, because we would hope that by that point you should be back on a more even keel. So if you haven't returned to that baseline where you were previously, it's worth talking about that to the doctor as well. Lastly, I just wanted to mention the signs and symptoms that you should look out for in the early days and then further down the line, just if you do need further help. So obviously, if you get any wound infection, pain, redness, swelling, or pus in a wound, you definitely need to get that checked out. You can probably make an urgent appointment with your GP for that to get that reviewed. If you're having any fever or night sweats, again, that might be a sign of infection. If you're having any new palpitations, dizzy spells, blackouts, chest pain, very short of breath, then those are things that I think you need to get checked out more urgently, and that would be a call, depending on how soon you are post-op. Usually in the first week, the ward will give you a contact number that you can call back for advice or support. So it may be something with the wounds and things like that that you could check in with. But if you have some of these really significant problems, severe chest pain, I'm not talking about wound pain, but if you get some different new significant chest pain or very short of breath all of a sudden, or you start having dizzy spells or blackouts, that's when you need to be calling the emergency services and letting them know that you've very recently had heart surgery. The only other thing to mention is just staying safe long term after an operation. It goes without saying, attend all your follow-ups and keep track of when your follow-ups should be and chase them up. If you've had aortic surgery, you will need probably lifelong follow-up of your aorta with intermittent scans and surveillance echoes. So again, appointments can get lost in the system. So if you've got a diary, you can mention, oh, I should be having an MRI scan in every May. If that's not coming up or an appointment hasn't been sent out, chase it up, because you want to be in charge of your health and making sure you're getting the scans you need. Something that some people like to do now is keep some of the relevant information either in their wallet or on their phone. If, for example, anything did happen to you, even if you were involved in a car crash or something, having this information available makes it a lot easier for people to get you to the right place in a timely manner. So this is just a screenshot of the medical page on an Android phone that I have, but you can enter details here. And I would just remember that your local hospital where an ambulance would take you might not be your specialist hospital. So it's really helpful if you can have that information readily available, the type of operation you had, the date of your operation, the contact details of your specialist centre, and a copy of your last clinic letter or discharge summary, because that can give them really key information and perhaps help them make a diagnosis much more quickly than if they're trying to dig up all this information if you're not able to tell them if you're acutely unwell. So that's just a bit of a whistle-stop tour of recovering after an operation. Again, we're here as a trust. We're happy to help. If you're worried before your operation, after your operation, do get in touch. We can be a listening ear. We can offer advice, and we're very happy to help. Thanks very much. I'm happy to answer any questions.
Thank you so much, Joanne. That's such a relevant talk. And a question has emerged immediately. Do you have advice on taking HRT through surgery time?
Taking HRT through your so during the post-op phase, I presume.
Is Anne here to clarify?
Yes, Anne.
I just want to, I'd heard sort of different things. Some people say that you need to come off it before. Some people, I wouldn't want to. I want to stay on it. I don't want to start going through menopause symptoms during heart surgery and just after. So some people, my nurse at my GP surgery said, no, you'll be able to stay on it all through the time. They'll put your gel on every day. There won't be any up and down of hormones while you're in hospital. But I didn't know if there was, you know, our hospitals might vary. You know, what's the advice on this?
It's quite difficult because we have, I know, obviously Dr. Rafiq earlier today was talking about the fact that HRT, yes, they're happy for people to be on HRT with Marfan syndrome and the aortopathy. So that's one point. But I think at the moment there are still differing opinions, because certainly at our centre, often what doctors wanted to know was about the type of surgery they'd had and the risk of blood clots and warfarin, you know, all those interactions. So at the moment, from my personal experience working in a surgical centre, often the doctors very much went on a case-by-case basis and would sometimes speak to the endocrinologist looking after that patient, discuss their care, what they were planning to do, are they going to be on anticoagulants, and take it from there. And actually we would get an answer on a patient by patient basis, because I think, again, the numbers aren't, certainly in the Marfan population, the numbers aren't big enough to be making kind of recommendations for everyone. I don't know whether I don't think there's any of the adult team here anymore who can give any more information.
No, thank you.
Any further questions for Joanne? I'm searching the chat feed. To no avail. If a question occurs to you later, you just simply need to email us and we'll answer it for you.